decline. States begin school unlock. But third wave threat still real. And children await vaccine. Are classrooms safe? Will you send your kids to school?
And that's our top focus right here. You're watching India Today with me, Nabila Jamal. As fear of the third wave looms large over India, the Punjab and Uttarakhand governments have now decided to reopen schools from tomorrow. While Punjab schools to reopen for all classes, Uttarakhand classes will begin for 9th and 12th standard, 9th to 12th. In fact, remember, no vaccine has so far been approved for kids in India, and maintaining social distancing, ventilation will be huge challenges for schools to face. Our next report here with more on that.
The pandemic is not over. Majority have not been vaccinated. There is still no vaccine yet for children. But the fast pace of adult vaccination and falling cases and fatalities have given hope. State governments have started reopening schools. Schools in Punjab are open from Monday for all classes. Punjab government has instructed schools to follow proper protocol to ensure COVID-appropriate behavior. Only teachers who are fully vaccinated will be allowed inside classrooms with students.
स्कूल जाने का तो मन तो करता है पर वी शैल नॉट ओपन जब वैक्सीनेशन आए तब खोलना ज़्यादा सेफ रहेगा
बड़े बच्चे चलो 10th या 8th ਤੋਂ ਬਾਬਾ ਜਿਹੜੇ ਉਹਨਾਂ ਦੇ ਖੋਲ ਦੇਣ ਠੀਕ ਹੈ ਜੀ ਬਟ ਜਿਹੜੇ ਥੋੜੇ ਛੋਟੇ ਬੱਚੇ ਆ 6th ਤੋਂ ਨੀਚੇ ਦੇ ਆ ਉਹਨਾਂ ਵਾਸਤੇ ਜੇ ਥੋੜਾ ਜਿਹਾ ਰੁਕਣਾ ਚਾਹੀਦਾ ਹੈ
ਸਰ ਸਕੂਲ ਤਾਂ ਜ਼ਰੂਰ ਖੁੱਲਣੇ ਚਾਹੀਦੇ ਆ ਕਿਉਂਕਿ ਘਰਾਂ 'ਚ ਬੱਚਿਆਂ ਦੀ ਸਰ 2 ਸਾਲ ਵਿੱਚ ਬਹੁਤ ਜ਼ਿਆਦਾ ਪੜ੍ਹਾਈ ਬਰਬਾਦ ਹੋ ਚੁੱਕੀ ਹੈ
Punjab government's decision has been welcomed by the private schools and a section of the parents who are happy that now their children will be getting the regular classes. But a section of the parents is not happy and is apprehensive, particularly the parents of the children who study in primary standard. They say that the news about the COVID-19 third wave is around. The administration should have avoided opening schools up to primary standard till the COVID third wave is over.
Even Uttarakhand has decided to open schools from classes 9 to 12 from Monday. State Education Minister Arvind Pandey has asked all schools to strictly follow COVID-19 protocols and classes will function in 2 shifts wherever number of students is higher.
Uttarakhand government taking the decision that the school can open because the 2 years was very tough for the student, those were studying online. Now they can come to school and study offline also.
After reopening of schools in Haryana, 6 students from a school tested positive and have been put under home quarantine. Parents are apprehensive but hopeful. Will children across India finally be able to shake off the 1.5-year-old hiatus from classes? Bureau Report, India Today.
Well, there you have it. As the COVID-19 pandemic there just cooling off, we're looking at several schools all set to reopen. I'm going to cut across to some of the reactions of experts so far on what they think of schools reopening in India amid a threat of a third wave.
We need to develop a strategy that all of them can come back to the education system, and that's why physical classes should start. We need to have a mechanism, like you said, where the positivity rate is low. We can look at schools, half the school on one day and half on the other day, do some screening tests when the children come, have some good ventilation, and also data is emerging the children already have good degree of antibodies. So where the infection rate is low, we may try and open up schools gradually and see whether it works with good surveillance. So if the cases rise, we can always close the schools down again.
मेरे विचार से अब धीरे-धीरे देश के स्कूलों को खोलना चाहिए विद्यार्थियों के लिए। ऑनलाइन क्लासेस होती हैं, लेकिन ऑनलाइन में वो बात नहीं बन पाती जो ऑफलाइन आमने सामने बात होती है। आज की खास करके दिल्ली की स्थिति है कि कोरोना के केसेस मिनिमम हैं और 12वीं क्लास को बुलाकर शुरुआत की जा सकती है स्टैगर्ड वे में। मेरी इस बात में सहमति है कि जहाँ भी कोरोना केसेस कम हो वहाँ पर धीरे धीरे स्कूल फेज मैनर में खोल दिए जाएं तो बच्चों की बेहतरी के लिए अच्छा रहेगा।
Dr. Galeria's statement is extremely balanced and mature because we can't get away from the fact that schools should remain closed. All over the world, schools are opening. They're opening in bubbles. They're being staggered in their opening because we can't afford to lose out. It's been nearly 2 years now and our children have no education. And I'm not talking about elite schools or private schools. I think we have to also look at the whole of India, which is not elite and private.
All right, I'm going to cut across to our panelists joining us with more on that. We're seeing growing encouragement for schools to reopen coming in from experts themselves. Let me ask our panelists here. Jyoti Arora, Principal of Mount Abu Public School and Governing Body Member of the CBSE, joining us. We also have Dr. Maninder Singh Daliwal, Associate Director, Pediatric and PICU, Medanta. We also have Sumit Agarwal, parent and a software professional himself. Let me start with our principal here. Madam Jyoti, if you can really tell us what's your view of children coming back to school, sitting in classrooms. You know, really in India with the kind of population that we have, it's really a luxury for to maintain social distancing. And of course, a child's nature, you can't hold them against it for letting down their guard, sitting close to their friends, pulling down their masks. So how is it really possible for a school to keep vigilance?
This has become very important and essential that schools should reopen with staggered approach, with appropriate COVID protocols and following all the measurements of COVID precautions. Because it's not just being away from the academics, it's being away from the socialization. It's very important that children should be back to their normal routine, even if they attend the school in small groups, even if they attend twice in a week. That's perfectly all right with parents' consent. But this is the high time that we should definitely think seriously about how to open the schools. Rather, discussion should be more about how to open. There should be
how is your school going to manage the students coming in, Ms. Jyoti? What's the protocol that you will follow?
Yes, as per my school is concerned, we laid down the SOPs with regard to COVID protocols last year only, when we were thinking that schools will reopen after somewhere around July or August. So if I have to talk about these protocols, it's all about training and orienting the system with regard to maintenance of social distance and then wearing of masks, adding sanitization stations, adding more hand washing stations, and then opening the schools in staggered manner. Arrival and dispersal also in staggered way, and training the students how to deal with the situation. That's the most important factor. At the same time, we need parents' cooperation also.
Yeah.
Because schools should reopen only and only with the parents' consent. And when you say that which class and which age is fine to be back to the school, I think here we would look up to our experts and virologists and doctors.
I'm going to switch to our expert on that note, Ms. Jyoti. Do stay with us. Dr. Maninder Singh, of course, we heard the AIMS director, Dr. Randeep Guleria, also very clearly stating that it's about time that you come up with a mechanism and ensure that children are back to school, because they've been off the educational system for over a year, and it's really changed the whole dynamics of a child appearing in person and the kind of social interactions. It's taken a big beating, not just for their academics, but also mental health. It is very difficult now, a year and a half later, for students to come back to class, socialize and be part of that social circle right there in school and be okay with it. Many might be joyous, many other will be anxious as well. But before that, a quick question: is it safe to get back to school?
Hi, thank you for calling me. So basically the question is, should we open the school or not? Is it safe? So I like to answer it in two ways. You have asked the question, is it safe now to open? It depends on the epidemiology. India is very diverse. So in some cities and states where the positivity rate is quite low, So schools can be reopened in a very phased manner. But saying that, again, I'm saying that it should be a very calculated decision. Just because people are tired or burnt out, or just saying that a lot of malls are open, cinema halls are open, so we should open the schools. That's not the right way to look at it. The right way would be, are we prepared to open a school? And if we are prepared to open a school, are we ready just in case if a lot of infectivity takes place in kids?
Well, you spoke about now many schools are opening up as early as August 2nd. That's tomorrow. Quite literally, you have schools in several places, including Uttarakhand, Punjab, who say enough is enough now, let's open schools. Not all classes are open. 9th to 12th most likely is going to open up. Do you believe that now, without a vaccine that's come up in India, it's safe to send your child to school, even if you're maintaining protocols? Because we know it's at the end of it, COVID-19 spreads by in-person contact. You meet another person who's asymptomatic as well, you could still catch the infection and be symptomatic. So without a vaccine, is it okay?
So if you look at totally from a safety point of view, and not from the holistic point of view, then definitely it's a risk that we are taking. And but you have to understand, school is a different ecosystem. We cannot just equate it to any other ecosystem. Here, a lot of children are going to be combined in a very small class, and they might not wear mask, or their mask might get soiled, and they might not properly follow hand hygiene. So there are many decisions that have to be taken. It's not going to be an easy job at all.
Undoubtedly. And now with all that talk about a third wave looming large, and that kids could be vulnerable to the third wave more than anybody else, at a time like this, many schools are opening up, and that's why it leaves us really anxious. I'm going to cut across to the parent as well. Sumit Agarwal. Sumit, are you confident to send your child to school? Will you or will you not?
No, definitely, as the panelist has mentioned, that definitely if I have to compromise the safety of my child sending her to school, it is very difficult for me to do that. There is a lot of uncertainty that is still looming around, a lot of science which is yet not known about this virus, how will it impact, and vaccination for children is not very sure, right? On one hand, we are talking about the neonatal or pediatric ICU being prepared in emergency for children coming third wave, and on the other hand, we are talking about sending children in a crowd in a school like that. There is no denying of the fact that we are losing on a lot of learning aspects of children when they go to physical in the school, social development aspect, or even the physical growth. Children are sitting at home, always in the front of computer or laptop. We are losing a lot of those things.
No, how much can you do online classes? At the end of it, in-person classes is really what gets you that edge, gives you that
definitely.
edge.
So definitely we are challenged with that. We think that children should go to school for that reason. But am I ready to compromise the safety for my child just in contrast to that? No, not very, because I am not comfortable in sending my school, because I'm not sure whether schools are ready to handle this kind of
No, but then if schools are starting off, it's not like because you're uncertain. Now we know that parents' consent needs to be taken, but what if some parents are not consenting, many others are consenting, and then what are you going to do? How are you going to really manage?
If I don't have a choice, then probably I would agree with most of the experts here that if staggered approach is followed, then probably yes, I am ready to take my child to a school for 2 days or 3 days in a week on my escort, and probably let's see how it behaves. But definitely I will always remain anxious and apprehensive about my child sending to school in such
Okay. Ms. Jyoti Arora, it appears that as per the experts, a staggered opening could be a solution here. Now that schools are opening up, we are seeing across the country now, over the next few weeks, schools will open up, especially for the senior school, 9th to 12th. Do you think a staggered way of functioning will really help reduce in-person contact, ensure that students are sitting spaced out, they don't come in close contact with each other? Any strict protocols you as a school principal yourself has put out? In fact, you're also part of the governing body for the CBSE.
Yes, it's very important that school should reopen only and only with staggered approach, whether it is about dealing within the school system or the arrival and the departure time. Even if we are able to cater 30% of students on a day, even if a child is attending the school just twice in a week, I think that will give a confidence to each one of us to deal with the system in a more confident manner. Staggered approach is really going to help us, because when there will be less number of children in a classroom of 40, say if you have only 12 or 15 appearing on a day, And of course, the hybrid model will continue. We cannot completely switch over to in-person teaching learning process.
Yeah.
This hybrid model has to be continued. And with this kind of approach and with strict following of the COVID appropriate behavior, I think we should at least give a try. Because I have been judging.
Are you asking for more time? Is that what you're saying? Are you appealing for more time for schools to open up? Do you think this is too early?
As I said that we were prepared even last year because we were expecting the schools to reopen somewhere from the month of July and August. Even if we get 10 days or 15 days to complete check the system, I think we are okay with 10, 15 days we need to get up the system.
Right. I'm going to cut across to Dr. Maninder on that. Dr. Maninder, we know that vaccines haven't yet come out. What's the status on that? And also, I'd like to ask you if children so far are rather immune to COVID-19, because at least going by the trend all through the pandemic, there hasn't been very, very rare cases of children facing severe COVID-19 health issues.
Agreed. So the first question was basically vaccination. So vaccination for children, definitely it's in the pipeline. I think so by October end, the government of India will start vaccinating the adolescent age group, like 12 or year onwards or maybe younger also.
Right.
And that is the vaccine part. And the second part is the COVID in children as of today has been very mild and mostly asymptomatic type. As already shown in the study by Dr. Gularia, the seroprevalence, lot of children are already having antibodies. So we are quite safe in that manner.
Are you speaking based on a survey that children have found to have more antibodies?
Correct. That is, though it's not entirely population based, but I do agree that a lot of children were exposed in the second wave and they do have antibodies.
All right, great. That's good to know. Children have antibodies by and large as per whatever survey has been done. Sumit Agarwal, as a parent, is there any guidelines or rules or advice that you have already conditioned your child to? What exactly have you told your child? If at all you're going to go to school, these are the rules that you got to follow. Give us a few pointers so parents can follow suit.
Yeah, definitely. I think there are a lot of general guidelines like social distancing. Please don't put off your mask, always wash your hands, and if you have put on your mask, don't take it off at any time during the school. And if you have taken it off due to some situation, then probably go and wash your hands immediately. So these are some of the things I am definitely going to tell my daughter. And I agree with, I think, Ma'am Jyoti, that probably, yes, hybrid model. I'm also willing to take my time to make sure that school has technical infrastructure to make sure that the hybrid model works, right? Because a few of the children would be online, few of the children would be offline. How would they handle such a teaching module to the students also? So that is also important to see. And that's why I said the staggered approach of me having been looking into it, how it behaves or pans out, how the school opens up. I would definitely be interested. But yes, due to some of the positive aspect, we do like to take this risk. Again, as Doctor mentioned, antibodies, but how long they last, we don't know, right? My daughter was also impacted, so I don't know.
Dr. Maninder, you answer that. How long will these antibodies last?
So if you got infected in the first wave, your family, then there's a chance that your child developed antibodies and it would have waved out by today. But in the second wave, so it takes at least 9 to 12 months. There's no fixed answer, but when the time goes off, the antibody levels decreases.
Okay. In fact, we know that in the United States and several other countries, schools have already begun, not just for senior schools, but also primary schools have started off. So that's some sort of consolation for us that it's not all bad, that we can manage. But only difference is their population versus ours. They probably have much fewer children in a class, while we, even if we have to open it in a staggered manner, even if we have to have half the class appearing, that still would be about 50 odd children or more. I'm talking about the budget schools, the international schools. Of course, they have their space and all that. But what about the others? Doctor Maninder, to you. Many countries have already opened up. Is that any solution or some cue that we need to pick from? That it's going to be fine?
We are a very different country and we cannot exactly follow what they are doing, but definitely saying that we have to start someday. So why not tomorrow? But the system has to generate a confidence in a parent that it's safe for him to send a kid to a school.
Jyoti, many schools abroad have opened up. Have you taken a cue or two from how they are functioning there, and any strict protocols while opening up? In fact, I'd like to ask you if your school is going to be opening up for senior students.
Yes, I have friends in other parts of the globe, and when I ask about their experience of reopening of the schools, I think the staggered approach and orientation of students, training of students, is really working a lot. And same we should follow here. A small group but fully trained, and then a complete check, and then there should be a system. Like I said, addition of more hand washing stations, addition of more sanitization stations, addition of more system in things in the system, so that they follow the social distancing norms, and then talking to the student in the class on regular basis, and then checking them. I think all this is going to help us a lot. And as far senior or junior is concerned, as I said before, to my understanding, school is important for every school going age. So here the experts should decide which class, which age is safe to reopen, but children should be back to the school. We are excited to receive them back in the system. And I just wanted to share that I have been judging a very reputed essay writing competition at international level. And I have been reading about the experience of children from Sri Lanka, Bangladesh, UK, Singapore. Everywhere across the globe, children are missing their school a lot. They want to go back to the school.
Especially senior school students, we know for a fact are waiting to get back. That kind of normalcy is what students particularly are missing. And that interaction with another student, 1 year is huge loss to that social skill. Thank you very much, Ms. Jyoti, Dr. Maninder, Sumit, for joining us and sharing your sentiments here. Schools to be opening up in about a week's time. In fact, several states are already opening up on the 2nd of August. That's tomorrow. And many schools have already their protocols in place, including students strictly to wear their masks, to maintain social distancing. Only a bunch, just a small number of students will be allowed in school. Hand sanitizers, of course, are kept. The entire school is sanitized, and all those protocols are followed strictly. You have many states now that are opening up, including that of Punjab, Uttarakhand. We know several other states like Andhra also will be opening up on the 16th of August. So these are schools that will open up after being sensitized by the respective state governments. And we heard Randeep Guleria also very clearly saying that it's about time that children come back to school and start with normal life, of course, with protocols in place. And we hear the vaccine should be out hopefully by October latest. Dr. Maninder, a quick word. Is that the status there? October is when a vaccine for children above 12 will come out?
I'll just say at the end of this year.
Okay, and any few vaccines that you would like to name that are now rolling out a vaccine for children?
I think Subsided and Bharat's are the two, biotech are the two in pipeline.
Okay, both. In fact, internationally, we know there are vaccines that are now, Pfizer has already come out with a vaccine for children. Has it been effective?
They are doing studies and they are finding it, like against a Delta variant, they are doing it. So it's quite early to say what is the efficacy in children.
All right. Let's just keep our fingers crossed and move with faith, and of course, be cautious with all the protocols followed. Thank you very much, our panelists, for joining us. And that's it for now. It's a wrap on this bulletin. Stay tuned. An India Today special coming up next.